Hello and welcome to GastroVision. I am Dr. Qazi Suhail. I am from Government Medical College, Srinagar, and we have started a series on hepatology. Today is lecture number 8. Let's start. So today's topic is Alpha-1 Antitrypsin Deficiency. Alpha-1 Antitrypsin Deficiency is an autosomal recessive condition in which there is deficiency of alpha-1 antitrypsin. Alpha-1 antitrypsin is a protein that is important for degradation of serine proteases in serum and urine. Most importantly, it degrades neutrophil elastase. It forms a complex with it 1:1 complex and helps in degradation of neutrophil elastase. Now, coming to the pathophysiology and clinical findings of alpha-1 antitrypsin deficiency. When there is a mutation in alpha-1 antitrypsin gene, which is also called SERPINA gene, there will be accumulation of abnormal alpha-1 antitrypsin, and this mutant alpha-1 protein gets accumulated inside endoplasmic reticulum of hepatocytes, which leads to decreased release and thus imbalance in proteases and antiproteases in serum and tissues. So what happens, there is decreased inhibition of tissue proteases. It is more prominent in two organs, one is skin and lungs. In skin, due to unopposed proteolysis, it leads to a condition that's called paniculitis, although this condition is very rare. In the lungs, due to unopposed proteolysis, there is destruction of lung parenchyma, which leads to pan-acinar emphysema. So what happens in liver? Due to accumulation of abnormal protein, alpha-1 antitrypsin protein, this mutant protein gets accumulated inside endoplasmic reticulum. This leads to endoplasmic reticular stress. When there is increased stress, there is increased oxidation reactions, there is formation of a number of free radicals, and these free radicals cause membrane damage and eventually damage to hepatocytes. So coming to the mutation part, the gene that's involved in alpha-1 antitrypsin deficiency is SERPINA1 gene. In this gene at position 342, normally there is glutamine, and this is replaced by lysine. And this replacement leads to formation of mutant alpha-1 antitrypsin, that's also called Z protein. And the pathology is due to accumulation of this Z protein inside the liver. So there are genotypes. M genotype is the normal phenotype, in which there is normal concentration of alpha-1 antitrypsin in blood. Another is MZ phenotype. It is the heterozygous type, in which there is only 35% normal alpha-1 antitrypsin. Rest is abnormal, that is mutant. In ZZ phenotype, there is less than 10% normal, while as in null phenotype, there is no formation of alpha-1 antitrypsin. So that's why when there is not any formation of alpha-1 antitrypsin, liver involvement will not be there in null phenotype, because hepatic involvement is secondary to the abnormal or mutant alpha-1 antitrypsin. Let's go a bit deeper in the liver involvement. So as we have seen, there are heterozygous and homozygous variants. that is MZ and ZZ phenotype. In ZZ phenotype, that is the homozygous variant, there is accumulation of abnormal mutant proteins. There is abnormal accumulation of alpha-1 antitrypsin and it leads to cirrhosis in adulthood. While as in ZZ phenotype, you can see in 10% of newborns, there will be cholestasis and 50% will continue to have transaminites at the age of 3 months. In the null phenotype, as I have already mentioned, there will be no liver involvement. This condition has a variable progression and there is increased risk of cirrhosis. In ZZ phenotype, there is also increased risk of HCC, especially in men greater than 52 years of age. Now, what is the diagnosis of alpha-1 antitrypsin deficiency? In this condition, we have to detect mutant alleles by doing PCR analysis of genomic DNA. And we can do rapid sequencing of SERPINA gene by a method that is called resequencing molecular array chip. Now, coming to the management of alpha-1 antitrypsin deficiency. It is the most common metabolic disease for which liver transplantation is performed, and the 5-year survival rate is very good. It is around 83% in children and it is around 90% in adults. Replacement of alpha-1 antitrypsin has no role in the liver pathology, but it has a role in lung pathologies and skin pathologies. Another molecule that's called phenyl butyric acid. It's a small chaperone that helps in increasing the secretions of alpha-1 antitrypsin. It increases secretion. While it increases secretion, it decreases the accumulation of abnormal, that's mutant alleles. And some drugs like rapamycin and carbamazepine, they are autophagy enhancers. They increase the autophagy of these abnormal mutant molecules. Thank you for today. See you in the next video.